name is Makenzie, and I'm going to be demonstrating how to perform the acromioclavicular traction test. To perform this AC traction test, this patient can be sitting or standing. In this scenario, my patient is standing because it is more comfortable for me to perform it at this level. The patient's arm should be hanging naturally from the side with her muscles relaxed, and the examiner should be standing lateral to the involved or injured side. The clinician will grasp the patient's humerus proximal to the elbow, and their opposite hand will be gently palpating the acromioclavicular joint in order to stabilize the clavicle and scapula during the test. The examiner will then apply a downward traction or pull on the humerus. If the humerus and scapula move inferior to the clavicle and there is a step-off deformity, pain, or both, the test is positive. A positive test would indicate a pathology of the acromioclavicular or corticoclavicular ligaments, such as a sprain. However, this test should be performed bilaterally to compare each side of the patient, as the movement may be natural for them. An ultrasound is useful in detecting acromioclavicular pathologies in cases of trauma, inflammation, and degenerative changes. Patients displaying positive AC traction test results should be referred to a physician for follow-up radiographic stress testing and to rule out a clavicular fracture in case this injury is more than a ligament tear. This is a close-up shot of my hand placement on the clavicle and scapula during the AC traction test, and the placement of my arm on the distal humerus, and the traction that I will apply during the test. The acromioclavicular joint is where the clavicle meets the superior point of the acromion of the scapula. The AC joint allows for shoulder flexion above the head. The movements of the AC joint are scapular rotation, scapular winging, and scapular tipping. This joint also allows for scapular elevation and depression, protraction and retraction, and rotation. After searching multiple sources, including the textbook, it has been found that the evidence for the AC traction test is absent or inconclusive. Other AC sprain tests include the cross-body adduction stress test, which showed the greatest sensitivity of 0.77 or 77%. Other tests include the AC resisted extension test, which had a sensitivity of 0.72 or 72%, and the O'Brien test, which had a sensitivity of 0.41 or 41%. A study that I have listed below in the bio of this video references Rockwood et al. And the classifications of AC joint sprains. Type 1 is when the AC ligaments are sprained while the joint remains intact. Type 2 occurs when the AC joint ligaments are torn, but the CC ligaments are intact. Type 3 occurs when both the AC and CC ligaments are torn, but the fascia of the deltoid and trapezius remain intact. Type 4 occurs when there is complete dislocation and posterior displacement of the distal clavicle into or through the trapezial fascia. Type 5 occurs when the fascia of the deltoid and trapezius have been stripped off the acromion and the clavicle. And type 6 occurs when there is inferior AC joint dislocation into a subacromial or subcoracoid position.